Hi, my name is Cindy Walker. I'm one of the nurse practitioners here at Student Health Services. And today we're going to spend just a little time talking about healthy ear care, which is important to us all. So let's talk a little bit about cerumen and earwax. So we know that we need a little bit in our ears because it does serve as a protection. But when there's too much in there, that's when it causes a problem. So let's say, how do we get the earwax out if it becomes a problem? So if it's not a problem, a lot of times we'll just leave it and the body is very well designed, it'll take care of itself. But let's say it is causing some of those symptoms and we need to get that out. Well, there are different ways that we can do that. One is with a product called Cerumelytic. This is just your eardrops. These are over the counter, and I would always say follow the instructions closely because you shouldn't use these longer than 4 days. What they do is they moisten the earwax and help it to be removed, but just be really cautious on that, not more than 4 days on that. Let's say the earwax is not being removed that way. Well, at Student Health Services, we have something called an elephant device where we can actually put warm water, little hydrogen peroxide, or just warm water. We have someone that have problems with excessive drying in their ear. A lot of times we won't use a hydrogen peroxide, but if not, then we put a little hydrogen peroxide in it to kind of help break everything up. But this would actually, it would be a gentle irritation placed in the ear, and we would actually just gently squirt until we got this, the earwax removed. So the best thing is if we can not have the accumulation, but if we have to, we definitely do that. Now, manual is another way, but we don't do that here. We don't do a lot of digging in the ear. Usually that's a specialist that have a special kind of device. But you may see at times when the earwax is really close to the opening, we do have a curette that has a light on it where we can get that out of your ear for you. Now, let's say we did everything we could do for you. We've gotten the earwax out. You still have a lot of pain. Well, then we need to look at referring you to a specialist, an ear, nose, and throat specialist. Also, if we think that the tympanic membrane is ruptured, never we want to put anything in the ear. We would always take care of that, and sometimes that may be referral to ENT as well. Or if after we got the earwax out and you continue to have pain, that's not common. You may have a little fluid in the ear from the water, but through gravity, usually that comes out, or we can use a hair dryer to remove it if we need to. But if we continue to have problems, there are some individuals that we do have to refer to ear, nose, and throat provider. And we do have one here, Student Health Services, Dr. Holly. It's a privilege to work with him. He's here once a month for students that have continued kind of complicated issues that we need to see. So the most important thing, everyone, is just remembering good healthy ear care, making sure you don't put sharp objects in your ears. If you're having problems hearing or something's going on, make sure you follow up with us at Student Health Services. Or if you just have some questions, just go to our portal, go to that secure site, and just send us a message, and we'll be more than glad to get back with you, and then we can help you with that. All right? All right, we'll talk to you a little later.